Hi, good morning, everybody. This is Gabe, resident of the City of Oxnard, and I am at Pacifica High School right now, even though it's closed. Uh, just long story short, our office had planned a fairly large countywide conference that was going to be held today at Pacifica, and unfortunately, we did have to cancel it. As we found out a day later, all the school districts closed anyways. So, it would have happened regardless. But we had about 240 students from all across Ventura County who were going to come out here, and we're going to provide a day of leadership and prevention education and a bunch of great stuff that was planned by Ventura County, many Oxnard youth. And so I'm actually here just in case anyone didn't get the message that we had canceled, and I can just let them know. So far, nobody showed up yet, which is good. I'm glad for that, but just in case they do, I'm here. But since I'm here just waiting, I thought I would do a really kind of quick but brief a video about what's going on with COVID-19 coronavirus and specifically how it affects the city of Oxnard. So just some real basic information, and good morning to Alfonso and to Ty. Thanks for tuning in. But some really quick information about coronavirus or COVID-19. You may have heard this already, but I think it's worth kind of mentioning it again for folks. Um, some of the symptoms of COVID-19 or coronavirus are fever, which from what I've read is a very high fever, like 103 or higher, and it comes on like all of a sudden, right? It's not a gradual increase in temperature. A cough, so respiratory, just coughing and you can't stop, and which leads to shortness of breath, unable to catch your breath from how much you're coughing, or when you're not coughing, just kind of having shallow breath or feeling like it's very hard to take in enough oxygen. So those three specific symptoms for COVID-19 are very important because people showing up with like fever, runny nose, sore throat, like those typical cold or fever symptoms, those don't seem to be characteristic of people who have COVID-19. And so we want to remind people too, or I'd like to remind people just based on what I'm reading on this, that, how can you protect yourself from this? Number one, if you're sick with anything, doesn't matter if you think it's, oh, buenos días, Rafael. So if you think that you're sick with anything, if you have any kind of fever, you shouldn't go to work, you shouldn't go to school, you shouldn't be out in public. You should be resting, bringing in lots of fluids to get yourself better. But knowing that someone with a fever or a sore throat or who is actively expelling any kind of bodily fluids, you are probably contagious to those around you. So, regardless, you should never like go out in public if you have like those kinds of symptoms. However, know that if you are sick with anything, don't go to work, don't go to school. But for preventing, contracting any kind of communicable disease, but especially COVID-19, they're encouraging a really good hand washing hygiene. And we want you all to know that, or I would like you to know that hand washing, I reposted this really great article a few days ago about the difference between washing your hands for 5 seconds versus like 15 seconds versus 20 and 30 seconds, and just the difference that makes. The washing your hands, just putting soap and rubbing it around and rinsing it off for a few seconds isn't enough. Like even antibacterial soap, that's a total scam. Like don't believe that. All right. Hand washing is the longer and the more friction you provide on your hands, the better. The mechanics behind it is that when soap goes on your hands, what's happening is that it's bringing out the oils that are in your skin, and those oils are bringing dirt and other stuff that are on your hands to the surface. And when you rinse it, you're rinsing all that stuff that got brought off of your hands, which is why the article I posted showed under UV light the stuff that's on your hands is like 90 some percent of it's gone the longer, or if you wash your hands for 20 or 30 seconds. Hand sanitizer helps a little, but it's not like getting rid of stuff. It's just kind of like neutralizing everything you have on your hands, even the good bacteria that's on your hands. And since it's not really washing your hands, when you see the difference in UV light, while a lot of it's gone, you can still see between the little cracks and crevices, you can still see where there was stuff under the UV light when you use hand sanitizer. So in the absence of the ability to wash your hands, hand sanitizer is a great alternative, but wash your hands often, wash them thoroughly. All right, there, that's all for that. Um, as much as possible, avoid touching your face. I don't even know how many times I've probably touched my face in the course of this few minutes I've been talking on this video. But the reason for that is that that's the main way of of contracting the virus is through your nose, through your eyes, through your mouth. And so that's why they're asking you not to touch your face. All right. And then it's difficult, I know, but as long as you're washing your hands regularly, then if you accidentally touch your face with clean hands, okay, no big deal, right? Okay, make sure that when you cough or when you sneeze, remember this is a respiratory illness. So the droplets that are in your lungs that are coming out, that's going to be one of the ways that it's transmitted to other people. So if you cough and you sneeze into your hands, like as people had done for many, 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 many decades, centuries, I don't know, you're putting all those droplets into your hands, and then you're touching surfaces like your steering wheel or doorknobs, or picking these up on the store and then putting them back on the shelf. Or if you're not doing that, other people are doing that. And so the idea behind this is not to do that stuff into your hands. They're recommending like into your the pocket of your elbow right here. If you're not right-handed, you can do your left hand. All right, doesn't matter. Or your left and right elbow, I mean. The thing with that though is they're saying like people should be like bumping elbows or fist bumping instead of handshaking. But if you're coughing and sneezing into your elbow, like I guess I don't know, like the elbow transmission rates are really low. Regardless, just make sure that you're keeping your hands like free of your face and not putting respiratory droplets like into your hands. All right. Obviously, avoid close contact with people who are sick, especially if you suspect that or they suspect that they have contracted the coronavirus. But like I said, anyone who's sick should really be limiting contact with anybody else anyways. All right. They should be at home resting, getting lots of fluid so they get better. And the other point that's made here, as I already mentioned, stay away from work or school or other people if you're sick with anything or you suspect that you yourself have contracted the coronavirus. Like, just really isolate yourself, make sure you're home getting well. If things get really bad, then that's when you present yourself to a health professional, whether that be through emergency department, urgent care, or your doctor. Keeping in mind what's called social distancing, keeping yourself 6 feet away from each other or staying away from other people by at least 6 feet. So that way you're keeping yourself safe and others are being kept safe as well. So one other thing, this email I'm reading is from Senator Hannah Jackson. And real quickly, what I want to point out is that there are potentially state benefits available to assist California workers. So if you're unable to work because you have to care for someone who's been quarantined with COVID-19, you may qualify for paid family leave, which is, I believe, the state equivalent to FMLA. So keep that in mind. If you're unable to work because you were quarantined or you're ill because of COVID-19, you may qualify for disability insurance. If you lose a job or your hours are reduced, you may qualify for unemployment insurance claims. If a family member is sick or you have to do preventative care, you should be able to use your accrued paid sick leave by California law. And lastly, if you contract COVID-19 and it's through the course of your job, you may be eligible for workers' compensation benefits. So thank you to Senator Hannah Jackson for sending that along. All right, before I end the video now, I want to talk about specifically how the City of Oxnard has been affected and is taking steps to mitigate the effects of coronavirus COVID-19. And this is actually really extensive. An email came out from the city manager yesterday to all city employees, and then the city sent communication to the public about this as well. So essentially, the City of Oxnard has declared an emergency, which is actually a formal administrative step, which is done to be able to take other steps, but also qualify for special funding that comes down from the state or the federal government should things get worse or other things happen. But in some logistical things that the city has done, they have closed the following centers and programs. They've closed all 3 senior centers, which is the South Oxnard Center, Palm Vista, and Wilson. The 4 youth I'm sorry. Let me start my car because it's telling me, hey, you've been sitting here too long and your battery's draining. All right, hold on. Okay. So, right, we good? Okay. So let's see here. They've closed all 4 youth centers: the South Oxnard Center, the Colonia Center, the South Winds PAL Center, and the Police Activities League on K Street. Let's see here. The libraries, Colonia Library, South Oxnard Library, and the Downtown Library are all closed. Basketball gyms at Colonia, PAL, and Rio Vista are closed. The Colonia Boxing Gym is closed. All special populations programming is closed. And all field and facility rentals to outside leagues or other organizations are discontinued for the time being as well. These are all until further notice. There was no end date given. Didn't say to the end of March, the end of April. They just said until further notice, meaning the city will update people as those programs or facilities come back online. They've also discontinued all preschool activities, so the Tiny Tots and the preschool experience at Durley Park and at the PAC, those are closed until further notice. They have discontinued for the time being sales of junior high grad night tickets to Magic Mountain. I didn't see in the message if there would be resuming of those sales, or if it's just for a little while. They just said discontinue till further notice. It's in June, so I'm sure that they will honor tickets if they continue the graduation, but I would imagine they'd refund them if they end up having to cancel it anyways. But stay tuned for that if you have purchased junior high grad night tickets to Magic Mountain. A really important thing that was pointed out is that the water quality in the city of Oxnard is fine. This disease is not, or this virus is not transmitted through the water system, and I don't know if there's been rumors about that or what, but they made a point to say the water quality is fine. The water has been tested. The city's tap water and our water system has no COVID-19 presence in it, nor probably could it. So just know that our water system is perfectly safe to drink and use for other purposes. There will also be no library fines put out during this time. Hey, thank you, Rafael. Oh, I see your message. I will reach out to you after the video. So there's no library fines being assessed during this time while the libraries are closed. So if you have books that are past due that need to be turned in while the library is closed, don't worry about it. Just get them in and they'll scan them when the library reopens. But also important is that penalties won't be assessed for late utility payments, for utility for your water or trash or your sewer payments to the city of Oxnard. And they also won't shut off service during this time while this stuff's going on. All right. So last part is around city and public meetings. So right now, all of the commission meetings, all the CAGs, so like the Parks and Rec Commission, the Arts Commission, the Community Relations Commission, all those commissions have been put on hold for the time being until further notice. The City Council and the Planning Commission are the only public meetings that will continue. But there has been some stuff that's happened at the state level that has allowed some temporary modifications to what's called the Brown Act, or the Open Meetings Law. So that means that for all these public meetings for City Council and Planning Commission, they're only going to allow 15 members of the public to be in council chambers during those meetings. And I'm assuming that they're going to be doing social distancing during those meetings, meaning that people will probably sit 1 or 2 chairs away from each other in the city council chambers. And that's just my assumption. They didn't say that in the message, but if they're practicing social distancing, that's been a recommendation for that type of seating. Any overflow beyond 15 people for those meetings they will make the HR activity room across the street on 3rd Street available for people to view the meetings. And they also said the library meeting room B will be open, which is in the downtown library next to city council chambers. But they also said the library will be closed. So I'm not really sure how that would work. I'm guessing they'll open it just for the city council meeting if they need to use that room. Know that if you'd like to see these meetings, they are still open to the public for viewing. You can be either one of the 15 there in the council chambers or in the overflow rooms, or our city actually has the infrastructure, the technology, we've had it for a long time, to allow residents to watch the meetings at home. You can watch city council and planning commission meetings live at home on Spectrum Channel 10, on Frontier Channel 35, on the Oxnard.org website. Streaming through the website, you go to all city meetings, and there's a list of all the meetings, and if one is live right now, there'll be a little icon of a camera next to the meeting. You click that and you can watch it live, or you can watch it live streaming on the city's YouTube channel, which I tend to do now instead of go through the city's website. I think it works a little bit better than the system they have built in for viewing it online. Know that if you'd like to make a comment to City Council or to the Planning Commission, that you can do so in person if you're one of the first 15 to get there, but they're encouraging people to email your comments to the city clerk by 3 p.m. They didn't say which day, Monday or Tuesday, or I think the Planning Commission's Thursdays. So I don't know if they meant 3 p.m. day of, but I would recommend, me personally, I would recommend getting it to the city clerk by 3 p.m. the day before the meeting is supposed to happen. That just gives them, the city clerk, it gives her plenty of time to get it over to city council, and gives them at least 24 hours to review it before the meeting happens. So that's just my recommendation. They just said 3 p.m. to the city clerk. So, neighborhood council meetings, those are the meetings for each of your neighborhoods out at usually their schools or sometimes city facilities. The city has suspended all neighborhood council meetings until further notice, and so we'll know when those come back online. And the last thing is, they recommended for updated information, you go to vcemergency.com for information about the coronavirus or COVID-19. Go to reputable sources, go to the CDC, go to California Department of Public Health's website. The County of Ventura Public Health has their own portion of the website about the coronavirus. This is all up-to-date, factual information. That's where you need to be getting your info. Don't get it from sources of where they're saying that, like, oh, well, you can get it from drinking your city's tap water, or you can cure it by drinking bleach. Like, no, that's not how this works. Make sure you go to reputable sources to get your information. And even if you don't believe those sources, go to other reputable sources to double check it. But I guarantee you they're getting it from actual places that are doing the research on the virus to find and put out the most up-to-date, helpful information for the public to have. All right, so that's everything I have. City of Oxnard has taken steps to mitigate the continued spread of the disease, or I'm sorry, of the virus. And also, you may have heard all schools have closed. I do work in education, and all school districts in the county of Ventura will be closed at least for next week. I know that the Simi Valley Unified and Moore Park Unified School Districts will be closed at least 2 weeks, and that's because after next week, the week after that, is their spring break anyways. So they will reassess towards the end of their spring break how things are going in the county and if they're going to resume classes or not. So all schools are closed as of next week, and they will reassess to see if they do come back the week after that. Knowing that in the month of April, many of the districts have spring break for a week anyways, some have 2 weeks. But it's a very, I understand people can be concerned right now with the way things are and what's going on. With this virus, it may seem very concerning or scary for some, but know that the responses that school districts have done, and what like the City of Oxnard has done, and what the County of Ventura has done, is really meant to find a balance between having people prepared and know what's going on, but not freaking them out too. And I think a really good example of not getting enough information or correct information out there is demonstrated by seeing people hoarding items that really are inconsequential to preventing or getting over the coronavirus. So you look at people hoarding toilet paper and hand sanitizer. Well, you know, what are you going to do with all of that? Like, the amount you have now is probably sufficient for you. It's not like stores are going to close tomorrow. But also know that there are vulnerable populations. There are seniors, people with compromised immune systems. Those are people who are at higher risk for long-term injury, respiratory injury from the virus, or death from the virus. People like, my age group, people younger than me, people, middle-aged folks, fairly healthy people. This is a fairly mild virus that you'll get. I mean, you'll get a fever, you'll have a cough that'll hang around, you'll have some respiratory stuff, but we get over it. But the people I mentioned, the vulnerable populations, they are the ones who really need to be cared for. And the way that we help them is, number one, making sure they have the supplies that they need, like toilet paper and hand sanitizer, but also making sure that we are limiting contact with them, that if we're sick, we're not going out and touching surfaces at stores and at places of business and at our workplaces, and we're making sure that we're doing what we need to do to not contract it and then spread it to others. So anyways, that's just my little soapbox on that part too. It's not my coworker told me she read an article where the title was "The Coronavirus Isn't About You," and it's not. It's not about us as individuals. It's about getting through this virus that has come around, and will be around for a little while. I shouldn't say a little while. It will be around for a significant amount of time, but don't think it's permanent. Know that the idea behind this is to get through this. We have to take steps to protect ourselves, but also protect others around us, and make sure that we are updated on the information, factual information, and taking steps that we need to take to keep ourselves safe and keep others safe. So I thank everybody for watching. I will post this so you can watch it again for those who just joined or seeing the end of it. What I went over was some of the recommended tips for avoiding contracting COVID-19 and coronavirus, hand washing, all that stuff. Also some stuff from the state of California that says if you've been affected in your workplace or if your wages or job are affected, some of the safety nets in place that you may qualify for that can help you. And then also I talked about what the City of Oxnard has done, the steps they have taken to mitigate the spread of this. So I thank all of you for tuning in. I appreciate it. Thank you, Cherie. You always have the nicest things to say. I'll repost this for folks to watch, and I hope you all have a great day. Last thing I'll say before I go, I know I keep saying last thing, is I haven't had any videos lately because the last 7 weeks of work, this is always the busiest time of work for us. I have done 5 conferences in the last couple of weeks, big conferences. We were going to have our last one today, as I mentioned earlier, and we're writing a very large grant with for 10 school districts that was supposed to be submitted next Wednesday, but the state has delayed that because of coronavirus as well. We're still writing it. We're almost done with it, so that works too. But I've been very busy, so I have a couple of videos that now we're getting out of this busy time that I've been meaning to edit and put together, and I look forward to putting those out there. So thank you all very much. Hope you all have a great Saturday, great weekend. Be safe. Wash your hands regularly, please. Don't touch your face like I just did. and I'll see you guys soon. Take care.